Do you know that 10% of women of the reproductive age will develop endometriosis? And this is one major cause of infertility in women. What is endometriosis? Do you know the causes of endometriosis? Do you know if you have endometriosis right now, what are the signs and symptoms? Now, sit down, relax. Let's talk about endometriosis. At the end of this video, you are going to know everything about endometriosis. Now, let's start from what is endometriosis? You know, every month, the lining of your womb will shed and you will see your monthly cycle. Good. Now, endometriosis is when cells or tissues that are similar to those cells in your womb, when they are found outside your womb. For example, when you find these tissues in your ovaries or your fallopian tube, it is called endometriosis. Why is it called endometriosis? Because when this tissue in your womb, when it is shedding and coming out as menstrual period, monthly flow, it will also be shedding in those areas. And this time around, it will be trapped because there is no place for it to come out. Do you get it? That is endometriosis. Now, you will ask, what are the causes of this endometriosis? What can possibly cause this endometriosis? There are different causes. The first one is retrograde menstruation. During menstruation, for a normal person, when the lining of your womb is shedding, the blood will flow from your womb to your cervix, from your cervix to your vagina, and from your vagina to outside. But in retrograde menstruation, the blood will flow from your womb to your fallopian tube. Do you understand? From your fallopian tube to your pelvic cavity. Yes, it won't come out. Now, another one is stem cell migration. Stem cell migration, as the name implies, it migrates. Stem cells is a special kind of cell, very special. It helps to repair the womb every month. Yes, it helps to repair the womb. Now, in this endometriosis now, it's going to leave its normal position and migrate to another place. Okay, it can migrate to your fallopian tube, it can migrate to your ovary, it can migrate to your intestine, it can migrate anywhere. So when it gets there, it will now position itself, okay? It will now look like endometrial cells. And remember now that it is now behaving like endometrial cells. Whenever the lining of the womb is shedding, it will be shedding. Do you get me now? That is stem cell migration. That is the second cause of endometriosis. The third one is genetics. Some people, it runs in their family. It's not their fault. So, genetics, it happens. The last but not the least is long-term exposure to estrogen. Yes, these are the causes of endometriosis. Now, what are the signs and symptoms of endometriosis? What will you experience for you to determine that you have endometriosis? The first one is dysmenorrhea, painful menses. Yes, if you normally used to have painful menstruation, this time around is going to be severe. Yes, it's going to be very, very severe. The second one is dyspareunia, pain during or after sex. Yes, you're going to have painful sex. Another one is that you're going to have pain during stooling and pain during urination. You're going to have pain, okay, severe pain when you're stooling and when you're urinating, okay? Another one is heavy menstrual bleeding, okay? Yes, you're going to have heavy menstrual flow. It's going to be very, very heavy and painful. You're going to also have painful lower abdominal pain or pelvic pain. Very, very severe pain. And another one is you're going to bloat. Bloat. Yes. You wake up in the morning and you feel like you have eaten a whole pot of food. And the last but not the least is that it causes infertility. But let me tell you, if you have endometriosis, it is not the end of the world. You can conceive. Yes, you can conceive with endometriosis. In our next video, I'm going to explain how you can get pregnant with endometriosis. So stick with me. Yes, share this video and don't forget to subscribe to our channel. We'll see you on our next video. Bye-bye.